My name is Dr. Edwin Mairura. I'm an orthopedic surgeon based in Dallas. I'm here as part of the Mairura Foundation. I'm not by myself. We have 22 other volunteers from the United States. It's a mix of different doctors of different specialties, nurses, physician assistants, and our medical sales representatives. So we have a big team. Some of those guys are represented here behind me and to my left. Some have already started the clinical duties. So as a foundation, our goals are basically simple. We're really just trying to make the world a better place. And so we do that by creating access to healthcare, which helps reduce health disparities. And so that's one of the main reasons we're here, is we're addressing that by providing an orthopedic service. And so the team here is coming in to basically offer non-surgical treatment of some of the most common orthopedic ailments. So you think about things that affect the knee, the hip, the shoulder. And then we're also taking care of some of the fracture patients from motorcycle crashes, or the piki-pikis, as we would say here locally. And then we're also doing elective joint replacements, so replacing people's knees and people's hips. This is our second year here, so we're grateful to have the opportunity to come back. And we've just had a lot of support, and I can see the lines are long, and we're ready to work and help. A lot of the common things that we treat, I think in this municipality, a lot of the stuff is trauma. We're also seeing a lot of deformity problems with bad hips and bad knees. And so, and we also have our hand surgeon experts, so we're going to be addressing issues of the hand as well. My understanding is the numbers are bigger, but we also have a bigger team this year. So I would anticipate, I'm already hearing that we've had upwards of 1,500 patients that are waiting. And then the surgeries, I would anticipate it's probably going to be about 40 to 50. It's interesting, I think in the perfect world, and what you see commonly, at least in the United States, is the elderly, right? So we're having some of those, but we've just finished our word rounds, and we've seen patients as early, as young as 19, 24, just from different problems. Yeah, so it affects all common age groups. Yeah. You know, I don't want to make it seem silly or obvious. I think everybody should really live a healthy lifestyle. You know, watch your diet, exercise, keep a healthy weight. And if some of these things creep up, you know, just seek medical evaluation. I think our culture is very skeptical of doctors, so most people don't really tend to go seek health care. And sometimes there's financial limitations. I think sometimes, you know, there's also the stories of, you know, when this and this happened to my friend, they never walked again. And so people neglect some of these problems. And so then now when we come in for a camp like this, we're seeing people whose legs are rotated different directions, which is not ideal because some of those things have been neglected. So listening to your body, living a healthy lifestyle, and just watching your weight and being active.
Outside what has been said, that is about our lifestyle, watching over our weight and being active generally, it's about our health-seeking tendencies. Those who are sick don't have a tendency to go to hospital and seek aid. So we have one today, tomorrow we'll have 2, 3, and the numbers keep surging. And the reason for that is simple. The cost of healthcare has always been high, and the living standards of our people, actually we have a population that is basically poor. And some orthopedic cases, when you do them without such an arrangement as this one, they go to an extent of 500,000 and even beyond. Basically in Kisii, we have not had an establishment of a facility that takes care of bone issues, spine issues as such. Our people go very far to get these services. And so what we are trying to do through this kind of arrangement is that at some point we bring the services closer to the people through the medical camps, but our bigger dream as an institution is to have a center that will take care of these bone issues, spine issues within this region. And the Mairura Foundation actually has given us kind of a jump start. It has given us that energy that we need so that we can start this service for our people. So this is not something that is ending with this camp. And that's why I want to encourage our people that even beyond this camp, we are going to continue serving you. Don't fear on hearing that already we have 1,500 bookings. The 1,500 bookings, we are going to serve them, but even after the camp, we'll make sure that everybody has been served because the hospital is not going anywhere.